3 patients have fully recovered from coronavirus pandemic at Entebbe Grade B hospital. The Prime Minister, Dr. Ruhakana Rugunda, accompanied by the Minister for Health, Dr. Ruhakana, the Director General Health Services, Mwebesa, the Permanent Secretary, Dana Twine, and officials from World Health Organization and Center for Diseases Control received certificates of the patients that have recovered.
Thank you very much, Right Honorable Prime Minister. And we want to assure the community that have received all the certificates of the 3 patients, and they are going to leave the hospital. We are going to transport them to their community, and I think they will receive it. Thank you.
Health Minister Dr. Ruhakana said the 3 cases had undergone treatment and have since tested negative twice for the virus.
The ones we are discharging today have spent a total of 21 days in the hospital. It takes time for the viral load to go down. They have been good patients, following the standard operating procedures, very cooperative. But Right Honorable, I must tell you that they have refused to sign to be exposed to the media, so you won't be seeing them. We have to respect their rights. If they have said no, it is a no. So you will not be seeing the patients who will be discharged officially today.
Dr. Cheng said the families of the 3 recovered persons have been prepared to receive them and urged the community to avoid stigmatization. Another batch is set for discharge.
But we also have 15 others who are ready for discharge. But we have not yet prepared their communities, so they may be going perhaps on Easter Monday to their homes. If any gives consent, then we shall allow you to interview them. But as long as they have not given consent, we cannot do that. So I must apologize on their behalf to all of you. But I request that we continue praying for each and every one of them. Right Honorable, none of them has progressed to the severe disease. They have all been very stable and receiving their medicines. We had many people come up to donate some of the medicines that we are using, including chloroquine and hydroxychloroquine, from their own pharmacies. They have been giving it willingly to the National Task Force. Again, allow me to appreciate the Permanent Secretary for ensuring that the patients are comfortable, and both patients and the medical teams have food available at any time that they need it.
The Prime Minister, Dr. Ruhakana Rugunda, commended health workers for the job well done, declaring Entebbe Hospital a center of excellence.
COVID-19 patients. Isn't it great to hear that the team of doctors and nurses treating these patients have been able to carefully look after themselves, and they are all negative? Isn't that a great thing, great achievement? In order to look after the patient, you must be safe yourself. So really, by looking after yourselves, you are in effect preparing yourselves to look at the patients very well. And indeed, you have proven it by having some of them discharged today and some more being discharged the day after.
It was identified as the first isolation facility for COVID-19 patients. And indeed, as you heard from the Director General, the first patient who was tested on the 21st was admitted here. And since then, as you have heard, they have a total of 30 patients. I want to appreciate them in a very special way for making us proud and doing a very, very, very good job. Right Honorable, as you are aware, world over, many health workers are losing their lives to COVID-19. It is a big, big battle. Day and night, all of us are praying that not any single health worker in Uganda should die to COVID-19. And when I talk about health workers, I mean even those who clean the facility or provide security to the facility, because they all make a team. It is our prayer, and thank you very much for being very strict about the rules, keeping yourself safe, as well as ensuring that the patients are safe. Allow me again, as I speak to the health workers, please do not get tired. This is a battle. It is a big battle. I am sure that even when you're working here, I know there are some television sets here, and you do watch what is going on in the other parts of the world. It is a big battle. It is a battle that is still ongoing. We are probably at the beginning of the battle. While we are happy and celebrating some people going home, we have to be aware that many other people may be coming in. So continue to encourage one another. Do not forget to rest. If you're tired, don't push it, because you may end up doing something that we shall all regret. If you're tired, you say, I am tired. Take some rest. Encourage one another. All of us need counseling. All of us, right from His Excellency, the President, the Prime Minister, all of us need counseling at this time. Just a call to your friend is good enough to encourage one another that we can still go on, we can still make it. So take off time and do that. Please drink plenty of water. Don't tell yourself that since you have a mask on your face, you will not drink water. Please take off time when you get out, put in plenty of water so that you keep well rehydrated. Don't forget that there are other diseases other than COVID. So when you fall sick, also let yourself be subjected to all the tests. We don't want to focus on COVID and miss other diseases and lose even one health worker to any other disease. Thank you very much in a special way. And before I sit down, allow me to thank the incident manager.
Right Honorable Prime Minister, may I add my voice to thank you for accepting to come and join us on this very important function which is taking place today. Secondly, I want to thank our health workers who have made us very proud. I really want us to clap for them in a very big way.
He's always very humble. He wants to keep at the background. We appreciate. Right Honorable Lieutenant Colonel Dr. Chove Henry is an epidemiologist and also a researcher, and is doing a good job in the incident management, cooking from our EOC and guiding the entire response and guiding the entire country. I want in a special way to say a big thank you to him. And also to thank my teams in the Ministry of Health, the entire team. It is not an easy time for all of us. I have been telling them that this Easter season, we don't have Easter. Actually, to the contrary, yesterday nobody even knew it was a Good Friday. We had to remind ourselves, all of us, including the WR, CDC, we also work 24/7. We shall have Easter when God allows, and we shall have a weekend when God allows. For all of us, it is a great honor to serve rather than to go and make merry. We can thank the Lord wherever we are, and this is the right time to say,
you had 30 here, so you have 27 after discharging the 3.
Yes.
What is the condition of the 27?
We are not allowed to take patients' details, but in short, I can say they are stable.
I want to take this opportunity to appeal to our respective communities to warmly welcome these friends who have been discharged and integrate them properly, reintegrate them in your respective communities. After all, you have been assured by the minister and her team that these people have been properly treated and they have been given the requisite tests after treatment, and they have been clearly declared healed. So you have no reason not to reintegrate them in their communities so that they resume their normal life. Therefore, I'm happy that the Ministry of Health is taking extra measures to make sure that the communities are sensitized. And I would like, therefore, the RDCs, the mayors, the LCs, to ensure that this process of reintegration is understood and the community is pacified so that there is no any hitch at all.
The remaining 50 patients confirmed to have coronavirus are said to be in stable condition. 21 of them at Mulago Hospital, 27 at Entebbe Grade B Hospital, 1 in Ajumani Hospital, and Hoima. Uganda previously confirmed 53 cases of novel coronavirus. 3 have now recovered and no deaths have been reported.
I'm happy to report that the categories of the patient we have discharged, or the ones we are having in Entebbe isolation unit, are young people. These are people who are below the age of 40 years. We only have 2 who are above 40 years. So COVID-19 also has other comorbidity factors. If you have HIV, you have chronic illnesses like diabetes or hypertension or cancer, this disease advances more. But the patients we are having are in Entebbe. We are lucky that these patients don't have other additional diseases. So I'm sure this has been a benefit and it has helped them to improve. The only advantage was we got these patients early enough, started them on treatment and monitored them.